Mental health is often seen as a personal journey shaped by individual choices, resilience, or genetics. But in reality, our mental well being is deeply connected to the world around us. Broader societal forces such as economic stability, access to education, and systemic racial inequities play a powerful role in shaping mental health outcomes. For many African American communities, these structural barriers have led to persistent disparities in accessing and receiving quality mental health care. For Black mental health professionals, understanding these systemic challenges isn't just about professional expertise, it's about navigating a shared reality while supporting others. Many carry the dual responsibility of championing mental health equity while facing the same obstacles they work to dismantle. It's a demanding balance, but addressing these social determinants of health is essential for building a mental health care system that's not only accessible, but also just, inclusive, and culturally attuned. This blog invites you to explore how income, race, and education intersect to influence mental health, from access to care to overall emotional well being. Together, we'll take an analytical yet compassionate look at the systemic issues affecting mental health and highlight actionable steps toward creating a more equitable and supportive landscape. By taking a holistic view of these challenges, we hope to inspire meaningful change while fostering a sense of care and connection for all. Understanding social determinants of mental health. Mental health doesn't exist in isolation. It's deeply influenced by the environment where we live, work, and grow. The social determinants of health, SDOH, factors like income, education, employment, neighborhood conditions, and systemic discrimination play a powerful role in shaping overall well being. These determinants are especially critical when we consider mental health disparities within African American communities, where historical and structural inequities have created persistent barriers to care. Research tells us what many already know from experience. Economic challenges, ongoing racial discrimination, and limited access to quality education can fuel stress, anxiety, and depression. Over time, these factors don't just affect individuals, they ripple across generations, perpetuating cycles of struggle. Consider these examples. Income disparities often determine whether someone can afford therapy or access health insurance that includes mental health support. Racial discrimination, whether overt or systemic, creates chronic stress, increasing the likelihood of anxiety and depression. Educational inequities can limit mental health literacy, making it harder for individuals to recognize symptoms, seek help, or advocate for themselves. These interconnected factors show us why mental health solutions can't stop at individual treatment. To truly support wellness, we must address the root causes of distress, the broader social conditions that shape mental health. By doing so, we not only help individuals, but also build stronger, more equitable communities where everyone can thrive. Together, we can work to create an environment where mental well being is achievable for all. The role of income in mental health access. Financial stability plays a vital role in accessing quality mental health care, yet income disparities often create significant barriers for African American communities. These challenges, deeply rooted in systemic inequities, can feel overwhelming, but understanding the issues is a crucial first step towards creating meaningful change and fostering mental well-being. The cost of mental health care. The cost of therapy and psychiatric services can be daunting, with sessions often ranging from $100 to $250 in many areas. For those without comprehensive insurance coverage or any insurance at all, these expenses can quickly add up, making consistent support feel out of reach. While programs like Medicaid offer some relief, navigating these systems can be frustrating, especially when finding providers who truly understand and respect diverse cultural experiences. But it's important to remember that seeking help is a courageous step, and resources, though sometimes challenging to access, do exist. Financial stress and mental health. Financial stress, whether it's living paycheck to paycheck, managing debt, or enduring job insecurity, impacts not just wallets, but overall well being. Anxiety, depression, and stress related conditions often arise when basic needs like housing, food, or healthcare are uncertain. If you felt this weight, know that you're not alone. Recognizing how financial burdens affect mental health is the first step in prioritizing care, even during tough times. Workplace disparities and access to employer sponsored mental health care. For many African Americans with steady employment, workplace benefits like mental health resources remain unevenly distributed. Jobs in under resourced industries may lack robust employee assistance programs, EAPs, wellness initiatives, or comprehensive health plans. Even in workplaces where these resources exist, stigma around mental health can discourage seeking help. Creating an environment where mental health is prioritized and supported is essential, not just for individuals, but for communities striving for equity and well-being. Taking care of your mental health isn't always easy, especially with financial hurdles in the way. But every step, no matter how small, is progress. By understanding the systemic challenges and seeking support where it's available, we can work together towards a future where mental health care is accessible, inclusive, and empowering for everyone. Breaking the cycle, solutions for economic barriers in mental health. We can expand access to affordable mental health care through community clinics, teletherapy options, and sliding scale fee structures, ensuring everyone has the opportunity to seek support. By advocating for policy changes that increase mental health funding in underserved communities and broaden Medicaid coverage, we can create a stronger safety net for those in need. Financial literacy and stress management are essential parts of mental well-being, and normalizing these conversations within Black communities can foster empowerment and resilience. Workplaces play a vital role to encouraging them to adopt inclusive mental health policies can create supportive environments for diverse employees. Financial barriers should never stand in the way of mental well-being. Yet for many African Americans, these obstacles often dictate whether care is accessible. Together, we can work toward a more equitable and compassionate mental health care system where everyone has the chance to thrive. The impact of race and systemic discrimination profoundly shapes mental health experiences, influencing how individuals navigate challenges tied to historical and systemic inequities, as well as daily encounters with racism and discrimination. For African Americans, the impact of systemic racism, bias in healthcare, and generational trauma creates unique mental health challenges that deserve understanding and compassionate attention. Let's explore these factors and consider ways to foster healing and resilience. Racial bias in mental health care. Many African Americans encounter disparities in mental health care, often receiving incorrect diagnoses or inadequate treatment compared to their white counterparts. For example, studies reveal that Black individuals are more likely to be misdiagnosed with severe psychiatric conditions like schizophrenia, while mood disorders such as anxiety or depression may go unrecognized. Implicit biases among healthcare providers can result in underdiagnosing symptoms and dismissing concerns, misinterpreting emotional responses to racism and stress as pathological, eroding trust in the mental health system, leaving many hesitant to seek help. Acknowledging these biases is a critical step toward building a more inclusive and supportive mental health care system. By working together to address these gaps, we can ensure all individuals feel heard, respected, and understood. The psychological toll of racism and discrimination. The mental health effects of racism often show up as chronic stress, a burden that can take both an emotional and physical toll, whether through microaggressions, workplace discrimination, or racial profiling. This persistent stress, sometimes referred to as racial battle fatigue, can lead to emotional exhaustion, anxiety, or depression, hypervigilance and difficulty feeling safe, physical symptoms like sleep disturbances, headaches, or high blood pressure. Systemic barriers, including redlining, mass incarceration, and unequal education policies, also reinforce cycles of instability and trauma within Black communities. Understanding and addressing these structural issues is essential to creating a path toward healing and equity, generational trauma, and collective healing. The history of enslavement, segregation, and racial violence in the U.S. has left a lasting emotional imprint on Black communities, a phenomenon known as intergenerational trauma. These deep wounds passed down over generations can still influence mental well-being today. However, there is hope. Practices rooted in culture, faith, and community offer powerful tools for healing. Collective support and resilience building can help break cycles of trauma, fostering emotional growth and empowerment. By embracing inclusive mental health practices and recognizing the importance of culturally affirming care, we can create spaces where individuals feel safe, valued, and supported. Together, we can work toward a future where everyone has the opportunity to heal and thrive. Addressing racial barriers in mental health care. Increasing diversity in mental health professions is essential to ensure individuals receive culturally competent care that truly meets their needs. Advocating for policies that address racial disparities in healthcare access and treatment can pave the way for a more just and equitable system. Creating safe, supportive spaces where Black individuals feel empowered to process racial trauma and seek help is a crucial step toward healing. Normalizing conversations about race and mental health within families and communities fosters understanding, connection, and collective growth. While race should never dictate the quality of mental health care someone receives, systemic discrimination continues to influence access, diagnosis, and treatment outcomes. Together, we can work to break down these barriers by acknowledging their existence and committing to actions that create a more inclusive and equitable mental health system. Every step we take makes a difference. And by prioritizing compassion and cultural understanding, we can help build a system that truly supports everyone. Education and mental health awareness. Education is one of the most powerful tools we have to shape mental health outcomes and improve lives. It not only opens doors to career opportunities and financial stability, but also builds mental health literacy, the ability to recognize, understand, and seek help for emotional well-being. Yet, systemic barriers in education disproportionately affect African American communities, creating challenges in raising mental health awareness and accessing care. The connection between education and mental health. Higher levels of education often lead to better mental health outcomes. Knowledge, problem solving skills, and access to resources empower individuals to navigate life's challenges with greater ease. However, systemic inequities like underfunded schools, racial disparities in disciplinary actions, and limited mental health education create obstacles for many African Americans. These inequities contribute to lower mental health awareness, making it harder to identify and address issues like anxiety, depression, or trauma, limited access to stable, high paying jobs that provide financial security and mental health benefits, increased exposure to chronic stress, particularly in under resourced school environments lacking adequate support, the impact of educational barriers on Black communities' limited mental health education. Many schools, especially in low income neighborhoods, don't offer mental health curricula. This leaves students without the tools to understand or articulate their emotional experiences. Disciplinary disparities. Black students face disproportionate rates of suspension and expulsion, disrupting their education and increasing stress. These practices often push students out of environments that could otherwise provide stability and support. Barriers to higher education. The rising costs of college, student loan debt, and lack of generational wealth create financial burdens that can exacerbate long-term mental health challenges. How we can bridge the gap. By addressing these educational disparities, we can empower Black communities and improve mental health outcomes. Together, we can make a difference through initiatives like mental health programs in schools, teaching coping skills and emotional intelligence equipped students to manage their well-being from a young age. Fair disciplinary practices, reducing racial biases in school policies, fosters a more supportive and stable learning environment. Scholarships and financial aid, easing the financial stress of higher education, allows students to focus on their growth and future. Community-based workshops offering mental health education for adults ensures that knowledge and support reach those who may not have had access before. When we create opportunities for education and mental health awareness, we break cycles of inequity. Every step toward understanding and empowerment strengthens individuals while building healthier, more resilient communities. By working together, we can ensure that everyone has the tools they need to thrive, mind, body, and spirit. The intersection of these factors and their compounded effects, social determinants of health, such as income, race, and education, don't exist in isolation. Instead, they weave together in ways that can deepen mental health disparities, particularly within African American communities. Recognizing and addressing how these factors intersect is essential for creating meaningful change and fostering mental well-being. Together, we can take steps toward solutions that truly address the root causes of these inequities. How these determinants interconnect and amplify challenges. A lower income often restricts access to quality education, which limits career opportunities and financial stability. This cycle can lead to chronic stress, increasing the risk of anxiety and depression. Racial discrimination impacts income and education opportunities, reducing access to higher paying jobs and quality schools. This creates additional barriers, such as higher unemployment rates, limited health insurance, and poor mental health outcomes. Gaps in education also limit awareness of mental health, making it harder for individuals to recognize or seek help for emotional distress. Without understanding mental health, stress and trauma can be normalized, leaving many to struggle in silence. Generational cycles of systemic racism, economic exclusion, and educational inequities further perpetuate environments where mental health challenges become a recurring struggle. A real life example, how it all comes together. Imagine an African American woman working as a social worker in an underserved community. She earns a modest income, making it tough to afford out of pocket mental health support, encounters racial bias in healthcare, which makes her hesitant to seek help, lacks exposure to mental health education, leading her to downplay signs of burnout. Her experience reflects how income, race, and education combine to create systemic barriers, making her mental health struggles not just personal, but deeply rooted in larger societal challenges. Breaking the cycle, solutions that make a difference. Addressing these interconnected issues requires more than individual solutions. It calls for systemic changes that are culturally relevant and accessible. Together, we can work toward expanding financial assistance programs to make mental health care more affordable, increasing the number of culturally competent mental health professionals who deeply understand and respect the Black experience, advocating for mental health literacy to become part of school curriculums, ensuring future generations grow up equipped with tools for well-being, tackling workplace discrimination to ensure equitable career opportunities and access to employer-sponsored mental health services. By understanding how income, race, and education intersect to impact mental health, we can begin to reimagine solutions that address both individual needs and systemic change. It's a challenging path, but with empathy, education, and advocacy, we can create a future where equitable mental health care is a reality for all. Advocating for change, building an equitable mental health care system, addressing mental health disparities in African American communities is a shared responsibility that calls for advocacy, systemic change, and community-driven solutions. While individual resilience is vital, it's equally important to dismantle the barriers that prevent access to the care and resources needed to thrive, especially for Black individuals and mental health professionals. Together, we can create a pathway to healing and wellness. Policy changes to improve mental health access. 1. Expanding affordable and culturally competent care. Let's make mental health support both accessible and relevant by increasing funding for community-based mental health centers in predominantly Black neighborhoods. We can ensure care is nearby when it's needed most. Legislation that reduces out-of-pocket costs through insurance coverage for mental health services can remove financial burdens. Additionally, recruiting and training more Black mental health professionals is key to fostering culturally responsive care that resonates with those seeking help. 2. Addressing economic disparities. Economic challenges often weigh heavily on mental wellness. Advocating for livable wages, debt relief initiatives, and financial wellness programs can reduce the stress and uncertainty tied to economic instability. Expanding workplace mental health benefits like employee assistance programs, EAPs, can also provide much needed support where people spend much of their time. 3. Educational initiatives and mental health awareness education is empowerment. Integrating mental health education into school curriculums can equip young minds with the emotional tools they need to navigate life's challenges. By training teachers, faith leaders, and community organizers to recognize and respond to mental health concerns, we can build a network of trusted individuals ready to offer guidance and support. The role of community in mental health advocacy. Systemic change starts with us. Grassroots efforts led by faith based organizations, Black owned businesses, mental health professionals, and community leaders can normalize mental health conversations and create a foundation of support. Hosting workshops and peer support groups in spaces like local churches and community centers can foster healing. Social media and digital platforms are powerful tools to spread awareness, challenge stigma, and encourage open conversations about mental health within families, breaking cycles of silence and building a culture of understanding. Together, we can create an environment where Black communities feel supported in their mental health journeys. With advocacy, education, and compassionate community efforts, we can move closer to a future where everyone has the resources and care they need to thrive, mind, body, and soul.